Thank you. Just a personal reflection. My mother-in-law, Sheila, she has Alzheimer's. She's had that for 15 years now. And we had planned when we moved to Horsham to bring her down here with us. We were prevented from doing so at the time. And so my wife Sandra was travelling up to Northamptonshire when she was allowed to visit Sheila. It was a very distressing time for her, for Sheila especially, also for Sandra, having to have that distance and that confusion that Sheila experienced, not able to understand why this was. We're very thankful that Sheila has come down here now. We've been able to have her down here with us in a local care home, and we're very appreciative of all those that have been caring for her and for others in especially difficult circumstances. We all have stories that we'd like to share, that we could share, maybe we will share today with one another. In a moment, I'm going to invite you to call out the name of the person or people you came here to remember. You may prefer to say the names quietly, but I would encourage you to call them out. We want to make a noise. We want their names to be heard. We will do this together. Don't worry if others are calling out at the same time as you. We will take our time. When we have finished calling out the names, we will have a period of silence to honour and remember those who have died. Then I'm going to say the words of the Lord's Prayer, and if you'd like to join me in doing so, I'd welcome you to join me in the Lord's Prayer together. So firstly, can I invite you to now take the opportunity to call out the names of those that you want to remember today.
Alan and Margaret Partridge.
Kirsty McCauley. My Auntie Molly.
Jane Bartholomew.
So now a period of silence, and let us remember. Beginning, Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power and the glory, forever and ever. Amen.
I'd now like to introduce to you Rosemary Pavoni, who I know some of you know very well today, to talk about and reflect what life was like in a care home during the pandemic.
I don't want to be too negative because there have been some very positive things that have come out in the last 2 years. But I just want to reflect what life has actually been like in a care home. COVID struck us like a tsunami, leaving us ill prepared as to what was about to happen. and frightened when we went into lockdown, but we were there to protect our residents and to try and keep them safe. We were left desperate to try and access PPE when most of it went to the NHS, and spending hours chasing private suppliers who had hiked up the cost if we could even get it. But we were there getting volunteers to make masks and tabards, and schools supplying visors. We were left trying to get food for our loved ones when all our deliveries stopped and the supermarket shelves were empty and food was limited. But we were there at midnight. I was emailing CEOs of supermarkets for help, and the one that came to my aid was Iceland. And so did the big wholesale companies who didn't have to supply to pubs. They came to our aid too. When the hospitals and government thought it was okay to discharge people to our care homes with COVID or without a test, thus seeding COVID into our care homes, with the awful result that 80 people died as a result, we were there caring for them at their last hours, holding their hands so they did not die alone, as their loved ones could not visit, but we were there. When the healthcare professionals stopped visiting, and we were reliant on video calls, often accessing people's end of life, we were there. We were there learning new skills, clinical skills, including wound care, physio, and definitely IT skills, which my staff weren't brilliant at the best of times. When the hairdresser, chiropodist and activities stopped, we were there to fill the gaps and to ensure that their needs were met, which included singing and dancing to break their day and their isolation. When residents with dementia were confused by glass screens and masks, we were there to help them and to try and support them during those very, very difficult times. When hundreds of conflicting guidelines were released, often on a Friday night, which changed within days, taking up our very valuable time, we were there trying to make sense of them and cascading the information to our residents, families and staff, often fearful of the consequences if we got it wrong. When the statutory authorities working from home thought it a good idea to catch up with their overdue assessments virtually, we were there scanning pages and pages of documents at a time when we were so busy. When staff had to have vaccines and were fearful of the outcomes, we were there to reassure and encourage them. When staff left, when they refused to be vaccinated, we were there to cover the rotas with already exhausted staff, only weeks later for it to be U-turned because NHS would not have been able to manage. When we had to implement testing regimes for our staff, residents and families, and had to operate a booking system, we were there to implement the guidelines and support the families who were desperate to visit their loved ones. But as the world opened up, it has not really for us, as we are still having to cover shifts due to staff shortages and isolation. But I'm not the hero of the day. My heroes are over there. I had Hayley, who covered me when I was having to isolate, and Claire and Karen, who moved into the care home for 6 weeks at the beginning of the pandemic to protect our residents. So they are the heroes of the day, not me. Thank you.
There today, but there's others here today who did so much during that time of uncertainty. And when did we think it was going to end? Hopefully it has, getting close to end. Then we find out this morning that Tim's gone and got COVID, so it's still out there. Care homes, hospitals, care settings, caregivers were all wonderful. They were amazing, and without them, I don't know where we would be today. When you said about Rosemary that people moved in and lived there, we saw that on the screens, caravans in the car parks of care homes and everything. So a massive thank you to all of those. What I'd like to do now